Welcome, everyone. Steve from Como, I am going to allow you to talk. Go right ahead.
Thank you. And Dr. Lindquist, your background looks great.
Oh, thanks, Steve.
I have a number of questions for you. I think we're just going to go with two today, just because I know that people are waiting. First one is in regards to the Delta variant, since I know that's getting a lot of attention right now. Are there pockets of concern that you're seeing in the state, and where exactly are those? Second question I have for you is, there's been a lot of discussion nationally about whether we should bring back mask mandates. Do you think that's a good idea? Have you had any discussions with Dr. Shah or Governor Inslee about that? And I know that Dr. Juchin with King County is holding a press conference right now, or an availability, and he is now recommending that all people, regardless of their status, once again, voluntarily wear masks in indoor public settings. So do you think that's something that people should start doing again?
Okay, so let's start with your first question. Yeah, I am concerned about this Delta variant. We're seeing this represent 58% at the last look of all our variants that are in the state. And let's be honest, the majority of these are in people that are not vaccinated. So in areas of the state where vaccination is low, that's the concern, is that you don't really have a lot of choice of what variant you're going to get at this point. It's most likely going to be the Delta variant. So I'm very concerned about areas of the state that have lower vaccination rates, that unfortunately the variant they're going to get is much more infectious. And I'll talk more about what I mean by more infectious as we go on through this interview. But that is my overriding concern. I'm very concerned about that. As to how does this apply to a couple things, I think there's a few things that we're watching that are concerning. One of those is we're seeing the onset of additional cases, or what I would call the fifth wave. And the majority of those are the Delta variant, not just because Delta variant is more infectious, but because that is the most predominant strain right now. So a lot of health officers are talking about, should we recommend universal indoor masking? Now, that's not a recommendation from the CDC at this point. We are talking about this for Dr. Shah's mask mandate and also with the governor, but there is no recommendation from state or from the governor at this point. But stay tuned, this stuff changes pretty quickly. We are not in opposition to locals taking more control and being more stringent. That is actually written into a lot of our approach to this, is that here is the state guidance, but locals have the ability, depending on their local epi, to be more stringent. So in a county where there's been no cases, we wouldn't expect them to be more stringent, but in a county where they're seeing case increase in the presence of Delta variant, it makes sense.
Thank you. Sorry, I left you hanging. I was just trying to ice you. Sorry, I'm trying to get in touch with TVW, but we are moving on.
Okay.
To Ariel. Thank you, Steve. Ariel, it's all you.
Awesome. Thank you. I'm curious, Dr. Lindquist, if you expect to see sort of a bump in hospitalizations following outbreaks of the Delta variant, like we're seeing in some other states like Mississippi and whatnot. And I'm also curious if this time around, Eastern Washington, Spokane particularly, has sort of followed Seattle in its trends. We sort of have had a lag. But I'm curious if this time around, if you think that might be different because the vaccination rate is so much higher than a lot of the Eastern Washington metro areas.
Yeah, so that's a complex question. Here's my take on this right now, is we are looking amongst the Delta variant, comparing it to hospitalization rates with every other positive case in 2021. We are not seeing a huge increase in hospitalization with the Delta variant. I know what the rest of the country is seeing, or other countries in the world are seeing increased hospitalization rates with this. So I expect we will likely see that. I'm just not seeing it in the data right now for the variant. I'm not seeing more people dying or being hospitalized with the Delta variant. But we are clearly seeing with an increased case count, we are seeing an increase in hospitalizations starting right now. So stay tuned, more to come on this, but I'm not seeing a disproportionate hospitalization with the Delta variant right now.
Thank you. Nicole, go ahead.
Good morning, Dr. Lindquist. Following up on that, we've been reporting at Cairo this week that a lot of hospitals throughout the Puget Sound are overwhelmed with patients right now, not necessarily because of COVID, for other reasons, maybe people who didn't get things checked out over the last year and a half and now it's serious. But knowing that that's going on, how is the state going to help hospitals all around Washington prepare for a possible surge in COVID cases come this fall? And then my other question is, for those of us who are vaccinated, what does a fifth wave mean? Does that mean that we all need to take a step back, or can we still basically go on living our lives and the restrictions, if any come back, would apply more to unvaccinated people?
Okay, so remind me if I don't get to your second question, because but the first question is, we work with the hospitals year round on availability. And in Washington State, our hospitals run pretty tight to max throughout the year. And so the flu season, or certainly COVID, can really stretch some of these hospitals. Now, we went through a terrible winter last winter and we were able to make it happen. So the quick answer is, with hospital movements, ability to transfer, with ability to surge, I think we're going to handle it the same as we did last winter if we see a surge in increased cases. And I think you said a really important point here is the hospitals are running near capacity now, but it isn't all due to COVID. So that's really kind of talks about the state of our hospital surge ability here in Washington State. So there's flexibility. We made it through last winter. I assume we'll make it through this winter with the same measures to help make room for folks if they need it to be hospitalized. But again, let me just say this really clearly. The majority of these hospitalizations can be prevented by people getting vaccinated so they do not get COVID-19. Now, the answer, it's a much more nuanced and detailed answer to, well, what do we do now? We're seeing this fifth wave. Yes, we are seeing a fifth wave, and we need to vaccinate so that we can minimize the people that are susceptible. Now, with breakthrough cases, this is really getting to the heart of breakthrough cases. Breakthrough cases mean you were fully vaccinated, so 1 dose of J&J or 2 doses of Pfizer and Moderna, and it's been at least 2 weeks since you've had them, and you get COVID over the top of that. We know the vaccines are not 100% effective. So we know. I'm having trouble hearing you. Oh, that's Siri talking to me. So we know the vaccines are not 100% effective. So we expect some breakthrough cases. And when we look at our numbers of breakthrough cases, they're not above what we would expect. And we report these to the CDC, and then we genotype them to make sure they're not a certain genotype. Having said that, what we are recommending is that you use common sense, whether you're vaccinated or not. Try not to be in crowded indoor spaces with poor ventilation in case someone does have COVID. Obviously, if you're not vaccinated, masks are still effective against this Delta variant and certainly this fifth wave of cases we're seeing. So you are hearing about some recommendations, some states or cities. You're hearing some health officers recommending, not requiring, universal masking indoors. And I think that is going to be our norm. Now, if this gets worse, we may see some requirements for universal mask coming from the CDC or from the state governor or Dr. Shah, but we're not in that place right now. It's up to us to have some common sense.
I guess Siri just called on herself.
Yeah.
Not even needed anymore. But let's go to Michael now from King 5.
Hey there. Thanks for calling on me. I don't know if you were starting with this. I just hopped in because I was getting off the call with Dr. Duchin in King County. So we're back to back today. Um, and that's what I wanted to ask you about. I mean, of course, Dr. Duchin, like literally 10 minutes ago, just said he is recommending indoor universal masking in King County to protect people. He cited a study from IHME that, and I'm parroting this because it just happened a couple minutes ago, that universal masking in Washington next week could prevent 540 to 880 deaths in Washington by November. So I guess with that number in front of you, we talk about common sense and protecting ourselves, but I guess I wonder why the state wouldn't consider 880 potential deaths prevented a reason to reinstate some sort of mask thing, if that has a place.
Yeah, no, that's a great question. I think that's exactly what we're discussing right now. That's why we're not challenging any of this local control. But you got to remember, Washington State isn't all King County. There are some counties that really have not had cases. So that seems a bit extreme for those local health officers and their elected officials. So, where we're at now is I'm comfortable with the local ability to be more stringent than the state. And don't forget, the state still has a requirement, so not a recommendation, but a requirement for masking if you're not vaccinated. So that doesn't change. What we're talking about is adding a recommendation to those that are already vaccinated if you're in an indoor space. So yeah, I think it's a great question. And, if we can prevent any death, then we should do it, which is why we're so strong about recommending vaccination. Because if we can get people vaccinated that don't get disease, that don't spread it to others, don't get hospitalized, and don't die from it, there is our real obligation.
Thank you. Now to Janelle from Yakima Herald Republic.
Thank you, Dr. Lindquist. My question's actually already been answered, so I'm okay to be skipped.
Okay.
Thank you.
Wow. Thank you for that honesty. Stand by. We are going to Ryan now from Seattle Times. Ryan, can you hear us? I'm asking to unmute you.
Oh, how's that? You got me now?
There we go. We got you loud and clear.
All right. Sorry. Thanks for taking the time today, Dr. Lindquist.
Yeah.
So with the breakthrough cases, I'm curious, is there a breakdown of which vaccines people were vaccinated with that have had breakthrough cases? And then is there any, do you have a sense if any of the variants are, driving any of the breakthrough cases?
Yeah, so a couple things I'll point you to. There is a breakthrough report and also a variant report that's put up on the DOH dashboard every week. It's updated with numbers. So the point is that this data changes pretty quick. So staying up to date on that will be helpful to you to follow this. To answer your question directly, yes, I have looked at, on these breakthrough cases, what is the genotype of those and what is the vaccine type? We're looking at other things because we're trying to use this to make sure that we're not missing. What if there was a big breakthrough in a group of people that all received the same vaccine because it was stored improperly? So it's the same lot number, came from the same distributor. Then we look into those kind of situations. If it's all one type of vaccine, which it has not been, that would be concerning too, to say, hey, look, we're seeing this vaccine be less effective. We are not seeing that. We are not publicly putting that in that report, and there's a disclaimer in there because what the percentage of the vaccines that are represented in the breakthrough really are reflecting is the percent of that vaccine delivered in Washington State. So if that makes sense. So we are seeing all three vaccines in the proportion that they have been delivered in the state of Washington. So not one vaccine sticking out against others as being a breakthrough vaccine. The same goes for the variants. We are looking at the variants, and we would expect, if you're looking right now, that the most common variant would be the Delta variant because it's the most common variant circulating. But we are not seeing extreme amounts of any of the variants above and beyond what is the background percentage of those variants. That is the concern, though. We are worried that the vaccine will have more breakthrough. Any of the three vaccines may have more breakthrough with the Delta variant. So we're watching that very carefully. I am not seeing a big signal on that to this point yet. But I'm very concerned about that.
Thank you.
Thank you. Next, we're going to go to Eleni with KXLY.
Hello, good morning. At this point, in the pandemic, for those people who aren't vaccinated, what do you want to say to them?
Well, I would look at it this way. Of course, I have friends and family that don't want to vaccinate either. But if I can prevent a single death by making sure someone gets vaccinated, then that's great. I want people to understand that this is not just about yourself. While it can save your life, it can prevent you from infecting other people. So, I've heard story after story in this pandemic where someone got disease, they gave it to their mom, their dad, their grandparent, or a friend who was immunocompromised and then had a bad outcome. So we have to think as a community, what's best for the community. I do think there are, and one of the things we want to make sure is that there are some people that are strongly against the vaccine. I don't think we're going to change their mind, even though they hear me saying, hey, I want to save your life or save the life of your loved one. There are some people that don't have access to the vaccine. So one thing we are being really aggressive about is having some diversity where people are getting equity to the vaccine. And I just saw my picture cut out. Are you guys all still there?
We can still see you, but I saw some of those. Oh, now I saw you drop out.
Yeah, you can still hear me though?
I can still hear you, and your video is back. It's kind of going in and out.
It must be the Zoom because my camera's still on, but yeah, it's okay. You guys don't need to look at me as long as you can hear my response.
Yes, so we still have you if you want to finish that thought, or we have two more reporters in the queue.
Yeah, no, that was basically it. It's about preventing death or hospitalizations. I want people, okay, I can see myself back. It's about preventing death and hospitalization, but it's also about thinking about those around you and making sure that we're doing everything we can. So I've said this multiple times. I didn't get vaccinated just for myself. Well, I don't want to have COVID, or if I get COVID and I'm a breakthrough, I'll have less serious disease. But I'm a pediatrician and I don't want to give it to my patients. I don't want to give it to the families of my patients. I don't want to give it to the elderly or those that are immunocompromised in my life.
Thank you. Next, we will go to Whitney.
Good morning. Are you able to hear me?
Yeah.
Okay, great. I have two questions, if that's okay. I will ask the first one and let you answer, and then I'll move on to the second question. My first question, though, is really just about there are a number of segments of the population, especially here in Eastern Washington, people who are opting out of getting that vaccine, and that's no matter how many education campaigns you may choose to do. So how much of a role could that play in a rollback of safety protocols for everyone? And at what point do you accept that the vaccination rates in some places are not going to go up anymore and that the virus is still going to spread?
Yeah, well, I think I've already accepted the virus is going to spread. We're seeing those cases increase now. So vaccine is not the only way to control this. We also have mask wearing. So my concern is if we get in a worse position, just like, King County or Dr. Duchin was announcing today, recommending more stringent guidance around masks may be the future for all of us, especially if we're in counties where there's large outbreaks or where we go. So, I know, vaccine is one thing, but there's also a lot of politicization of mask wearing, which just kind of blows me away. I'm much more interested in the science of the mask, not the politics of the mask. And so I think we're heading down a pathway, if these cases increase, where we're going to see more and more of these recommendations about more stringent mask wearing.
Thank you. And our final reporter question is from Kate.
Hi, thank you for taking the time today. Wanted to ask you about booster shots, Dr. Lindquist, and what your thought is. I know I'm sort of hearing from folks who are wondering, should they be seeking out a third shot or a second shot if they did the one and done? I know this is obviously still in the trial phase and being studied, but what is your thinking or recommendations to folks when it comes to things like a booster shot of the vaccine?
Yeah, it's a great question, Kate. The current recommendation is not for a booster. There is no authorization for a third dose in any situation. I do think, so that's the recommendation right now, no booster shot. But I do think, the vaccine manufacturers are clearly gearing up for a booster shot, which I think is exactly what they should be doing, getting ready for it, especially around protection with the variant. And as we get more and more evidence of what the booster shot will entail, that it's safe and it's efficacious, then we'll see some formal recommendations. I'm all good with that. I think if the science shows that there's some value in this, then we should do it, as long as it is safe and it is effective. And we're not there yet. But stay tuned, that will likely change during the next 6 to 12 months.
That concludes our reporter questions. Dr. Lindquist, do you have anything else you'd like to add?
No, great questions, you guys. You're on the cutting edge of this. Appreciate you guys taking the time and the interest in doing these stories.
Thank you, everyone. We appreciate you. Have a great day.